Hello, my name is Courtney Tellis. I did my final on South Shore Hospital's financial statements. South Shore Hospital is located in Weymouth, Massachusetts. It's the region's leading provider for emergency, acute, and outpatient care to the residents of Southern Massachusetts. The hospital is the first and only verified and designated Level 2 trauma center south of Boston, including the Cape and the Islands. South Shore Hospital holds 287 beds and has teamed with Dana-Farber and the Brigham to provide the best care possible to all patients. South Shore has consistently been recognized for the quality of care, being recognized as the top general hospital by the Leapfrog Group. The auditor's report that I reviewed was from the years 2015 and 2016. In 2016, there was an increase in cash of a little more than $6 million. The total net asset increased by more than $16 million. The total liability increased by a little more than $127 million. There was an increase in what the entity owed. The current accounts payable for 2016 was a little over $10 million. When reviewing the statement of operations, the patient service revenue is what jumped out at me most. There was an increase in over $35 million. The expenses also increased by a little more than $38 million. With the revenue increase, the expenses increase. Yet the revenue we would like to see have a larger increase. After reviewing the ratios, it became a little bit more clear to me that you can't just count on one individual ratio. You have to look at the big picture to make a financial assessment on the entity. For the current ratio, we did fall a little bit below the benchmark. However, but between the 2 years, hovered right around. The days in accounts receivable was as well a little bit higher than we would have liked. However, days cash on hand was higher, which we would like to see. The salary and benefits is 22% above the benchmark. This could look bad, however, it was due to the implementation of Epic. They had hired on many more resources, but this would be something that they should pay attention to. Also, the return on total assets and net assets is not quite where they should be. They would need to kind of take some better attention on that as well. South Shore Hospital is fairly close to the benchmark for the age of the plant. However, the long-term debt to equity was pretty close in 2015, and there was a pretty significant jump for 2016. In summary, the hospital's financial statement presents fairly. The results of its operations and changes in net assets and cash flow for 2015 and 2016 fall within accordance with accounting principles for the U.S. In my opinion, after reviewing the financial statements, I would loan the entity money. The hospital is proving as a whole they are providing the services to their residents. As a member of the community, I would continue to support the entity, and if in a financial position, I would make a donation for the entity to utilize. As the CFO, there are some small concerns. The salary and benefits need some attention. However, with the upgrade of the electronic health record, the implementation did increase the expenses and will eventually even itself out after a few years.